This is a lecture on the barriers to healthcare. I'm feeling a little under the weather here, so if I'm a little more nasally and a little more Godfather-esque, please excuse me. I'll just try to get through this as quickly as I can. But I think sometimes we take our healthcare in Canada for granted. And yes, it costs a lot, and yes, we are taxed very high. But, if this cold that I have right now escalates, I don't have to present a credit card to go to the hospital. I won't get billed later. And some people think we can't really put a price tag on that that's priceless. Now we can put a price tag because it's tax season and you see how much income tax you pay, and it can be very sobering. So that ties right into the first barrier, which is cost. And the cost of healthcare in Canada is rising, largely due to our aging population. So the baby boomers are in retirement, and usually as you age, you require more health care. Uh, and it could be also due to maybe unhealthy living practices, obesity, and such. But healthcare is rising, the cost of healthcare. So in the 60s, it took 5.5% of our GDP, um, 7.4 by 1980, 9.4 in 90, and then it dropped, and I don't know why, to 9.1 in 2000. So this is a little dated. However, um, according to the Globe and Mail, when the Drummond Report came out, and the Drummond Report was kind of an analysis of Ontario's social spending and where cuts should be made. And Don Drummond, who was the guy that was hired to conduct this study, said that if left unchecked, healthcare costs are set to reach between 70 to 80% of our total program spending by 2030. And that's really scary. So 70 to 80% of our provincial spending by 2030 goes to healthcare. Where do we fit in road maintenance? Where do we fit in education, my salary, and such? So that's really scary. So some people have suggested that we move to some models to help deal with the costs. And one of the things that has been removed or delisted, so that's the next blank. Some procedures have been delisted from healthcare to cut cost. Um, Earwax removal, vaccinations for travel outside of Canada, prostate enlargement, some chiropractic uh, procedures aren't covered anymore. Um, and what's some other things they considered? Well, some people think we should go to uh, a, a privatized model or a hybrid model where we have the option of paying for healthcare or going to a private hospital opposed to a public hospital. And some people think maybe to eliminate wait room in the emergency or wait times in the emergency rooms, that maybe there should be a drop-in center fee. Um, so to deter people from, having a hangnail and going to the emergency room, maybe if there's a fee, it might give people second thoughts to seek other ways of treatment. Um, the advent of like telehealth and online, the Ontario, like where you can go online and ask questions to a registered nurse. These are all things in an effort to um, cut down wait times and eventually cut down the costs. Ethics, and we talked a lot about social ethics, social research ethics in Unit 1. Uh, but should we use public funds to pay for medical procedures for elderly whose successful recovery chances are slight? And in Quebec, um, and the federal Liberal Party are looking at euthanasia laws. And so if people can die with the assistance of a physician, and die with dignity, will that essentially save money in the long term? I don't know. It's a very controversial thing, and maybe after the break I'll show you the case of Thierry Schiavo. Um, yeah, I will do that. Now, health literacy, the definition of health literacy is sufficient reading and comprehension skills to understand the diagnosis and treatment. Um, and they say a lack of health literacy is a significant barrier to healthcare. And many health professionals believe that we do not understand health terminology. Like, if you think about it, what does blood pressure mean? Okay, so I have high blood pressure, but what does that mean? What does a pancreas do? What is cholesterol? Why is there good cholesterol and bad cholesterol? Like, when you break it down, do we really know our bodies, and are we educated about our bodies as well as we should? I don't know the answer to that. Now, that's coming from a guy who's an English and sociology major, so uh, maybe if I took something a little more sciencey, I'd know the answers to that. And I'm being a little facetious. I kind of know, but um, overall in society, do people know the answers to these questions? And so some people may not seek out healthcare for a fear of being labeled as unintelligent. So in this class, I think we're all blessed because we're in a 4U class. We're in a small segment of society. We have the critical thinking, we have the communication skills to understand, to communicate. But not all of society is that lucky. And do people not fear the doctor because they just don't want that sort of interaction? They don't want to be feel like they're uh, unintelligent. Now, we do have a culture that gives doctors a great deal of respect. And, if I look, even a professor next year with a PhD or a medical doctor, they've studied likely 10 plus years in university, and we put them on a pedestal. And I have so much respect for them um, that some people think we don't question their judgments enough. Uh, and I don't. I probably take whatever they say. I'm like, okay, and I go on. Now, a lot of us have friends or family members who have nightmare stories about doctors and such. Um, and I guess we should ask for more clarification, but I know personally I don't. Um, and cultural insensitivity can be a barrier, as some practices, discussions, and diagrams are too explicit for some cultures. And even when you go for a physical, it's pretty awkward. And maybe it shouldn't be, but how comfortable do you feel talking to your doctor about uh, private matters, whether it's mental, sexual, physical? Do you really disclose everything that's going on? And you probably should, but I don't know if you do. Um, and I'll probably stop there. Um, Next one is the facilities for people with disabilities. So we've got a couple barriers here. The first one's architectural barriers, and these are structural problems for getting people onto examination tables. And even if you walk around your hometown, look at the accessibility for people with disabilities to get into certain buildings and businesses. Now take that and think about the doctors or the health professionals' ability to put them onto an examination table. It would be very, very difficult. Um, there's an attitude barrier, and that there's an unwanted assumption made by health professionals. An example would be that the disabled or the physically challenged have no sexual or reproductive needs, but they do. Um, and it's interesting just to watch people and how they interact with people in wheelchairs or people with crutches and stuff. Um, I've seen people who slow down their speech or up their volume of their voice when talking to people in wheelchairs, but it's not their hearing or their comprehension. It's a mobility challenge. I find that really interesting. And finally, is a knowledge barrier, and that we have a lack of knowledge about how a disability affects normal health needs. Uh, the fourth barrier is income. And people with lower incomes tend to benefit less from resources such as education and healthcare. And people in the higher income brackets tend to be healthier than others. And maybe you have the money to eat more healthy, more organic foods, maybe to join a gym and certain practices that promote health. People born within the bottom 5%, uh, people with income in bottom 5%, that doesn't make sense. They are twice before, okay, so people born in the bottom 5% of their income before retirement are twice as likely to die before age 70. I know that was really muddled. So if you're in the bottom 5% um, of income in Canada, you are twice as likely to die before age 70. Okay. High income tends to give an additional 12 years of good health, and income tends to play more of a role in the United States. Now, because they've got a two-tier system or a privatized system. Now that could be changing with Obamacare, and I'll have to look into that a little more closely after the break and try to give you a synopsis of what Obamacare is trying to do. And again, it's very controversial in the States, and we might not understand it because as Canadians, we've kind of embraced the idea of universal healthcare. I don't know if we've embraced the idea of high taxes, but we've accepted that high taxes leads to a good healthcare system, a good education system. In the two-tier system, and this is, I guess this is the final barrier, all citizens enjoy free, or sorry, equal access to free healthcare. All citizens enjoy equal access to free healthcare. But the point is, it's not free. We all pay for it through taxes. um, and so Michael Moore really focuses on this whole free healthcare, but we do pay for it. It's just through taxation, so we don't always see the bill. Health is a provincial jurisdiction under the Constitution, but the federal government or the feds contribute funds to provinces to pay for this healthcare. Under Canada Health Act, hospitals and doctors cannot charge extra fees. However, I do see extra fees when I go in, like for a back to work letter or a certain vaccination or a certain type of allergy tests. They are charging for that, and I don't know how that falls under the Canada Health Act. And so in the US, there's a two-tier system where only the elderly and the very poor have access. And what is elderly? How is that defined? Is it plus 80? I don't know. And what's very poor? And if you've ever seen Sicko, Michael Moore's Sicko, there's some well, it's all anecdotal evidence, so there's a lot of issues with Michael Moore and his documentaries, but you do get some examples of people being rejected healthcare because they just simply can't afford it. So I don't know how that all plays out. And in the States, people purchase healthcare coverage or their employers do it for them. It's like a perk of working. So conflict theorists, including Michael Moore, say because Americans have so much debt that they can't quit their jobs, they become good employees because if they quit, they lose their healthcare coverage. And finally, in Ontario, as I alluded to earlier, right now, well, actually 10 years ago, 44% of spending went to healthcare, of our social spending goes to healthcare. So that's a pretty significant figure, and it's scheduled to rise with our aging population. All right, so hopefully I filled in all those blanks that I didn't miss one. Um, Again, I hope everyone realizes how lucky we are to be Canadians and to have a good healthcare system despite the cost. Um, Thanks for listening.